Welcome to Resilience Rising, the podcast that shatters poverty myths, sparks optimism, and fuels innovative change through community-inspired discussions. The title of today's episode is Dignity in Dining, Ingredients for Creating Food Security. I'm Amanda Fellows, Community Programs Manager at CFS Counseling and Wellbeing.
And I'm Brian Shelley, the Chief Executive and Philanthropy Officer at United Way Simcoe Muskoka. Often, we think about poverty in terms of income without thinking about the impact of not being able to afford the necessities of a healthy existence, or the complexities that creates barriers for people to achieve those basic needs. Today, we'll be focusing on food security. What is it? How does it affect marginalized groups disproportionately? And what can be done to address this inequity?
On behalf of Brian and myself, I'm honored to acknowledge that we are currently recording on the traditional land of the Anishinaabe. The Anishinaabe include the Ojibwe, Odawa, and Potawatomi nations, collectively known as the Three Fires Confederacy. CFS Counseling and Wellbeing and United Way Simcoe Muskoka respect Indigenous history and culture and are dedicated to moving forward in the process of reconciliation with all First Nation, Métis, and Inuit people.
So Vanessa and Chris, welcome. Thanks so much for being here.
Thank you very much.
Thanks for having us.
Yeah, thanks for the invitation.
So we'll start just by maybe each of you giving us a brief introduction to what you do, where you work, and the scope of your roles. So Vanessa, we'll start with you. Tell us all about what you do.
Sure. My name is Vanessa Hurley, and I work at the Simcoe Muskoka District Health Unit. And my role there is public health nutritionist, and I support the chronic disease prevention program. One of our main areas, our priority areas, is working in the area of household food insecurity. So I've been working on that for a number of years now, and I'm excited to be here to talk about the potential solutions.
Awesome. And Chris?
Thanks, Brian. Chris Peacock. I'm the Executive Director at the Sharing Place Food Centre up in Orillia, Ontario. Our food centre has a food bank program that we run, as well as a Meals for Change program, which is a cooking program. Food recovery program, so we recover food from local grocery stores and farmers. And then also we have a school fuel program, so we support 23 local schools with their student nutrition programs. And then I also sit on a few different committees, some advocacy committees, and the Simcoe County Food Council, and a few organizations that are really working towards helping individuals that are food insecure.
That's great. And I've met both of you, felt privileged to work alongside both of you, and you guys do some cool stuff in the community, so really excited to talk about that today. Can we maybe start by just defining food insecurity and maybe food security, or talking about, we throw those words around a lot, you hear that a lot in the news now. Can you talk about defining those pieces and then maybe layer in some elements around what are the contributing factors to food insecurity?
Mm-hmm. Sure.
Why don't you go give the technical definition?
I'm more of a yeah, no, for sure. I can start off with household food insecurity for sure, because that is basically it can be a very simple definition for a very challenging problem. But essentially it's the lack of money for food. So households, every year, Statistics Canada monitors household food insecurity rates across Canada and locally. And so they're measuring the level of food insecurity in households based on lack of money for food. So they ask a number of questions related to, do you worry every day about running out of food? Do you skip meals? Do you have the same meals every single day? So there's a number of different questions, but it's a very standardized way of measuring household food insecurity nationally and locally. And so basically, people have no money for food, and it's lack of financial resources. So that's how we define household food insecurity. Food insecurity, on the other hand, is you have secure access to food. So you have an abundance of food that is sustainable, it's adequate, it's nutritious, it's accessible, it's culturally appropriate, and it's safe. So they're two very different definitions and measured very differently, but those are essentially the differences. And I'm not sure, Chris, if you'd like to elaborate on that.
Well, and well put. That's the technical definitions, and I look upon it, it's almost poverty. It's it's almost poverty rebranded to a degree. There's definitely individuals that live in poverty that are not food insecure, that just have a good social support network and are able to get supported with food, but it's very close to poverty. So it's it's an income problem, and it's tightly tied to poverty.
Yeah.
Yes, and it's there's a marginal, moderate, and severe definition too, and that's how we also measure it. But definitely, we see the numbers are unfortunately rising locally, provincially, and nationally. So in Simcoe-Muskoka, 1 in 5 households, or 18%, are insecure. And when we measured a few years ago, we had 1 in 8 households, or 13%. So we do recognize that it's worsening locally, and we're in crisis. We see this the same as the same rates are in the province and across Canada as well. And the latest report that came out from Proof, which is a very reputable body that does a lot of research in household food insecurity, they noted that in 17 years of monitoring the rates in Canada, that we are at the highest it's ever been. So
to put that in context, if we're saying it's 1 in 5, that's 1 in 5 households or 1 in 5 individuals in our community don't know where their next meal is coming from.
yes, that's right. It can be vary from worrying about running out of food to going days without eating. So it's quite a range. And just to add to that, so that's 1 in 5 households, but in Ontario, 1 in 4 children are going to bed hungry, going to school hungry. They're experiencing household food insecurity as well. So that's those statistics are pretty upsetting.
And so is that trend, I know I've heard that trend locally, so that's a provincial wide.
That's a provincial wide, yes. So it's
25% of kids
25%,
experience
yes.
food insecurity. That's
yes, just a few years ago it was 20%, and now it's at 25%. Wow. So,
and you speak to educators, teachers in classes, specifically elementary and high schools. They'll tell you, they know. They can see the kids showing up at school without food in their lunch boxes, and the behaviors in classes as well, the way it's changing. So it heavily affects young families.
It does. And just a few years ago, we do a survey at the health unit in the school setting, and just again, a few years ago, so old data, but over 2,300 students that were surveyed are going to bed hungry and coming to school without eating breakfast. So it's concerning locally for sure.
And it directly tied to inflation, right? Like these stats that we've yet to kind of get, we know is going to be much worse. And we know that just based on income levels not being appropriate to the cost of living. So we see inflation grow, and we know that food insecurity will follow.
Do they track a lot, or do you track a lot of data around related to income levels and people, say, accessing a food bank or reporting food insecurity? Because I'm just thinking about, even when we were a part of the Urgent Needs Fund, we had more and more families that we would maybe identify as, say, middle class, have middle class incomes, seeking out, the Urgent Needs Fund specifically for food, right? That's the primary reason people called Urgent Needs, was for food. Yeah. And anyway, it was disheartening to see that more and more people, earning higher incomes can't afford to eat.
Yeah. So do we track the data on site? So at our organization, and a lot of food banks across the country, it's a delicate balance between data and dignity. Right. And so you don't want to have an individual come in, first time accessing your services, or even those that unfortunately are chronically food insecure, that we don't want to kind of interrogate them upon entry and make them feel uncomfortable. But we know the value of that information would be able to get a better understanding out in the community, across the country. Policymakers need data to make big decisions. So we try our best we don't ask income questions at this point, because that's very evasive and can feel very personal to a lot of people. And so we know that, like, for our organization, you're getting a 7-day supply of food, and we don't want them to have to bring out their T4s and their income statements and all the support structure just to be able to access that food. But it would be nice to get that data. So it's a balance.
I want to ask you a bit about that, because I know that's we like to try and talk about some hot button issues, and I know that there's this conception in the community that if you don't ask for that proof, that people are going to game the system, right? And you'll get people accessing a food bank who may not need the food bank. What's your response? I mean, I'm sure you must get donors that ask that, or community partners that ask that question. What's your response?
Yeah, all the time. It's, to me, like there's there's an off the record response, which is, I guess this is on the record.
You can go off the record.
It's a question that's important to be asked, and I always thank people for asking it, because it's something that you need individuals to ask that question for people to start to understand that stigma that is attached to poverty, that people think there's individuals that are abusing the system and they're taking advantage, they're just getting handouts. And it is like maybe 5-10% of our communities tend to do that sorts of things. And that's like, why create this horrible experience for 90% of the individuals that are accessing your services? That feels just very like, again, just bringing all of your income and expenses out there just to get that order of food for a very small percentage of the population. Let's focus on the 90%. And I'm making that figure up because we don't know, because we don't track that information. But let's not focus on the 10%. Let's focus on the 90%.
Yeah.
I feel like you can see, like, even though you're not tracking the data, you can see some of that. I remember talking to you like right in the midst of COVID, and you were talking about how when they had, I'm forgetting the term, the basic income, but when they increased, what was that? What did they give people during COVID?
Yeah. Oh, the CERB.
CERB, thank
Yes.
you. Anyway, so when people were getting CERB, they went and bought food. And so I remember talking to you and you were saying, like, you know, we got lots of stuff here because people aren't accessing the food bank as regularly because the reality is when people have money, they buy food, right? And so I feel like that in and of itself is an example of that kind of like countering the argument that people are out there to screw the system when they have a decent income, when they have a basic income, buy groceries.
100%. Yeah, no, that is like really important to know. Like, we received a ton of support during COVID through the community and through the government, right? And our like food banks across the country did. And our demand was down.
Right.
And it was kind of one of those things that, to be honest, I'm very thankful for it because now we need that funds. And we were strategic with the way in which we ran our organization to ensure that we felt that was going to be the case, that like it's so
once that Band-Aid was ripped off.
Correct. And then all of a sudden you're struggling. So no, we had that cash reserve to be able to continue our level of service when demand truly hit, which is now.
Yeah.
But you are bang on when it comes to income matters, and that was just a wonderful example. We talk about when the current government came into power, they dropped the basic income pilot project, but technically CERB was one as well.
Yeah,
and it helped out a lot, but it was not managed in the way that this strategic basic income project was managed, which would have provided true data, where CERB was pray and spray technique, so it just wasn't strategic.
Yeah.
Well, and I think about what Vanessa said as well about also this idea that the number of children and youth experiencing food insecurity is that much greater than the general population. I think that's another argument also for basic income measures, because these are kids and they aren't in control of the income of their household. They aren't in control of the resources that they have available to them, and we know that they're disproportionately being impacted. You know, and speaking about disproportionate impact, I wanted to touch a little bit on marginalized groups. We know that racialized groups and other marginalized groups experience food insecurity at heightened levels. And Vanessa, I'm wondering if there's any data or we're trying to think away from data as opposed to dignity, but anything from the health from the health unit's perspective that helps to explain that, and why does food insecurity show up differently in marginalized households?
Yes. So what data that we have collected locally shows that there are some populations that are more vulnerable to household food insecurity. So our data has shown that lone parent families, in particular females, they are at, I guess, higher risk or more vulnerable to household food insecurity, as well as low-income families and those that rent versus own their homes as well. Although I did want to mention that in the new data that came out, I talked about proof data. It's families that have mortgages too in Ontario that are affected by household food insecurity too. So although we are talking about marginalized populations, certainly they have higher rates, but it's impacting everyone. But some are definitely more at risk of household food insecurity. So lone parent families, those that are renting versus owning, and low-income families as well. Certainly there's data provincially and nationally, we don't have this at the local level, but showing that some racialized groups as well and Indigenous households are experiencing food insecurity at higher rates.
Yeah, I mean, we can see that too. I mean, I don't have data to back that up, but even if I think about like our Sparked program and all of the newcomers or new Canadians we support through that program, I would say a very large percentage of them, you know, again, this comes back to basic income, and we did an episode on, you know, what it's like to be a new Canadian here and the expectation versus the reality. But many of them are experiencing food insecurity, right? It's a huge reason they show up to Sparked. They're looking, you know, for support in accessing food.
Yeah. And although we're not tracking newcomers, we also hear students at the university level. So our local colleges are reaching out and wanting to partner with us, and what can we do? And their food banks are high in demand as well. So it's also the university and college students as well that are experiencing it. Newcomers to Canada, yes, for sure.
Yeah, very difficult situation. Like it's tough, and it's that whole it's a racism conversation as well, right? And just it's tightly tied to poverty, and so that judgment that comes along with being potentially different than other people, and it's a struggle for many individuals. But I know food banks from the all the newcomers that have arrived, it's a difficult conversation for a lot of food banks, and being able to manage that new inflow of individuals that were essentially promised something that is not the reality of when they arrive in our country, and potentially been lied to. But that's a whole other podcast there, Brian and Amanda.
We do cover that. You know, you keep talking about food banks, but I noted when you introduced yourself, you made sure that it was clear that it was the Sharing Place Food Center, and that the food bank is one of your quote-unquote products.
Correct.
Talk to me about that, because I think that's a huge shift within this whole food security conversation. What is the difference between a food bank and a food center?
So a food bank is a program that delivers access to food. And so that's one of our programs. And so essentially it's providing, if a food bank can provide there's different ways to run a food bank, but essentially it's providing access to food. And then we have other programs that we deliver. So if it's our Meals for Change program, where we do a ton of cooking, we have this beautiful commercial kitchen that we produce over 2,000 meals a week and get it out into the community. And then if it's our school fuel program, so we as an organization, as well as there's another entity in our country called Community Food Centers Canada that does it well, and they have created this network of community food centers Canada, or community food centers across the country that provide more of a diversified approach to supporting individuals that are food insecure. And it also is a stigma thing, and trying to get rid of a little bit of that stigma. Is we're not just a food bank as an organization, but we also want individuals that are food insecure, that are struggling to afford food. They're not coming to a food bank, they're coming to a food center. It might be semantics in a way, but it's just another attempt to try to lower that worry or that concern or that fear for individuals that come into our facility, that they're not coming to a food bank, they're coming to a food center. And sure, you're accessing our food bank program, but there's more to the community that we provide than just access to food.
Yeah, I mean, and so interesting. I mean, I think, and Vanessa, you'll give me the correct stat. I'm sure I'm going to get it wrong, but I think it's that it's estimated that only 1 in 4 families that experience food insecurity are actually accessing food banks or food centers, which really is actually a great response. Also to those who say that there are people who are using food banks or accessing food centers that don't meet the criteria. Well, again, we know that actually 75% of the people who need to access it aren't even getting those supports because of the stigma. So whatever can be done to reduce the stigma, to remove those barriers is got to be, and that goes back to, again, why maybe you don't ask for proof of income. Whatever barrier you can take away has got to be important, because there's 75% of households that need the food that aren't even accessing it.
Absolutely. Like, that's our number one priority as an organization, and we share it with others throughout the county and the country, is that dignity, respect, welcoming, opening atmosphere is so important. It's the number one thing we provide at our organization, is that welcoming environment where people feel that they can belong. To try to get rid of that stigma. We work really hard at trying to get rid of that. And that's a big issue just in poverty, right? There's a stigma attached to poverty. People judge individuals in poverty, and they have no idea the life that individual has lived, the circumstance that they've grown up in. And if they did know that, it would be a complete change in the way in which we support individuals with low incomes.
Can you talk about some of the other ways? I want to talk about the Food Council too. Can you talk about some of the other ways too that the Sharing Place has created innovative opportunities to kind of change the way we view food banks? I'm thinking about food recovery, or even that you hired a chef. Like, those are all, like, the Sharing Place is a bit of a leader, I would say, even locally, around how you're transforming how people perceive a food bank. And I think it's also, or a food center, is also because of all the other things you do.
Yeah, because I will say that I am a former board member of the Sharing Place before your time. Yeah. And what you're talking about is a completely different organization than the charity that I volunteered at, that I was still very proud to volunteer at. But what we were espousing for, what we were wanted to get to is a lot more of what you're talking about today, which is exciting.
Yeah, it's like innovation in this, like there's a lot of talk about social innovation, right? And trying to like change the model of care and nonprofit organizations and just innovating moving forward. And I think that like, I'm very fortunate to have a wonderful board of directors. I'm sure it was wonderful when you were there too, Brian. But
become more wonderful when I'm left.
But they're very supportive of pushing the envelope and making sure we try new things and develop new programs. And there's almost an expectation on me every 2 months when we meet to ensure that something new is happening in a progressive way, and being able to identify the measurement that we have to prove why we need to do that. So it's, I would say that that's like just taking, and I grew up in the business world, right? And have a lot of experience in that sector. And that's like, you have to do that or you go out of business.
Innovate or die.
Right.
Yeah.
That's an essential part of business, especially now. And so kind of taking that skill set and bringing it into the nonprofit sector, it's that same thought process that we have, and it's been reflected in our balance sheet. Like, people want to support organizations that continue to evolve, move forward, get rid of things that don't work, and keep improving on what we do. And that's kind of been our philosophy. And I'm being thankful for an exceptional staff team and board of directors that have supported that. And now the staff come to me with new and unique ideas, and we try stuff. Like, we just started the new sharing action team, actually in partnership with CFS, and trying to find ways to get our members to advocate for themselves and teach them rules of advocacy and how it works and all that good stuff. And that's just a new thing that we just started a few months ago. So just as long as we keep changing it up a little bit and making sure it's smart with how we're changing, I would recommend any nonprofit to do that. Like, you can't be complacent, and you have to keep kind of evolving.
Mm-hmm. Yeah. And there's lots of community support and community effort around tackling some of these pieces. You chair the Simcoe County Food Council, right?
Yes, I do. Yes.
Can you speak to maybe what that looks like and why the council and what its purpose is?
Yeah, certainly. So Chris and I are both stewardship group members on the Simcoe County Food Council, and I've just currently taken on the chair role earlier this year. So the stewardship group is, I guess, kind of the body, how would you describe it?
I think this, you got to be careful because it's a community group, but it's like that the senior level groups of individuals that are trying to like steer it in the right direction. It's a steering committee.
It's a steering committee. Yeah, it's a fancy name, but we all are here to basically. So back in 2019, we created the Simcoe County Food Security Framework. And that framework includes a lot of actions that you can take to reduce household food insecurity and bring about food security in Simcoe County. So I would say that our role is to bring knowledge and awareness to this framework. We also have a charter which was created prior to this, which this came out of. But I would say that our role is to provide some leadership and guidance to all of the working tables that also have leads from the stewardship group. There's a number of different working tables now, from food skills education to food access, school food, just to name a few, as well as communications and fundraising, I think, is our newest table. So we have leads for all of those tables, and they are doing great work. Again, we're just getting up and running since the pandemic, but we have action plans, and we're releasing an impact report that's coming out very soon to show some of the work, highlight some of the work and successes that we've had. So I would say the council is about connecting people, collaborating, bringing about collective action, having common goals and priorities that focus on some of the indicators or things that we want to achieve in the framework.
Mm-hmm. Yeah, it's been like sitting on the steering committee, and I work on the food access working group as well, which is primarily food banks, but we welcome any organization that provides access to food onto that team. And it is awesome to sit once a month with a team of like-minded individuals that are all in the similar sector, being food banking and food access, and to be able to just share stories about like the challenges, the frustrations, the successes, and like, oh, I've got this problem, how do you guys solve that problem? And it's like fundraising and just different things that you can discuss. And then the other groups as well, if it's school food, the same thing, like bringing a bunch of organizations and individuals together that are trying to support school food. And it's just a wonderful knowledge sharing opportunity for us all to get better within that kind of collective food system. And it's been really good, like really useful.
The connections that are being made, the collaborations, it's starting to get some momentum now since the pandemic. So that's exciting. For sure.
And we're recruiting, so anyone listening to this podcast, please reach out to the Central County Food Council.
That's awesome. And
Yes.
I mean, I think the idea of all of these agencies and all of these bodies working towards addressing food security is, that's something we need to be doing across the whole gamut of issues that are impacting vulnerable folks in our community. Is we have to get away from this siloed approach. We need to be working together.
1,000%.
It's a collective impact. That's
Right.
a big word, but it just means working together, doing the same thing.
So
Makes a difference.
if we take that line of thinking, so we've talked about, that's how agencies and organizations are working together to make a difference. If we take it to the individual level, so our listener who is listening to this podcast and is understanding, like, oh my goodness, I didn't understand that 25% of kids in my community are experiencing food insecurity. I didn't really understand what it meant. How can an individual impact or affect food insecurity in practical and meaningful ways? And like I know, an easy answer is, well, donate to your local food bank. But beyond that, or is it as simple as that? I guess I don't know.
No, not that. Don't do that. Do that, clearly. But number one on that list is call your MPP, MP, and advocate, get noise, like upstream. Like we need to, the only way to solve food insecurity is to have the government create policies that support individuals in low income, period. That is like, sure, and affordable housing is definitely a core part of that as well. But income, technically, if it was high enough, you would be able to afford the crazy expensive housing.
I mean, I do want to. This latest federal budget has a lot in it. This is being recorded just a week after the federal budget was announced, and lots of a lot of focus on housing, but it kind of shies away from language on poverty. And I think back to your point, Chris, where we started this conversation about food insecurity. And so I apologize, I did cut you off there, but food insecurity is about poverty, housing and homelessness. There's an element of poverty there, and I think that we sometimes shy away from actually talking about the big P.
Yeah. Oh, for sure. And I don't know why. Like, that's a good question for politicians, right? Is that like, does that poll negatively to say the word poverty? I don't know. Like, but that is the problem. It's poverty. Like, it's low income, and also income. We don't talk about it like low income, and we don't talk about increasing people's incomes often in the political spectrum of things. Like, it's proven as this, like, what was it? Economist David Carr won the Nobel Peace Prize a few years ago on proving that increasing minimum wages increases economic productivity. Like, it goes against everything that there is, like these belief structures, these stories that we believe that if you increase minimum wage, all these businesses are going to go out of business, and it's not true. Like, I think they studied it where New Jersey and Pennsylvania, that could be wrong, but one state increased minimum wage and the other one didn't, and they studied like the difference between those two states and a lot of fast food joints, because that's where a lot of people make minimum wage, and none of they didn't hire less people, they hired the same people, they were just as busy as they were before. So it's strange, but it always boils, from my perspective, down to an income problem or a poverty problem. But maybe the word poverty doesn't poll well. I don't know. I'm not sure.
We do have poverty reduction plans at the federal and the provincial level as well, and we are seeing more municipalities in our areas, Aurelia being one of them, starting up to have municipal poverty reduction plans. So I would say, in terms of at the individual level, I know that there is an urgent need for food, and people feel so good about giving, and it's so important. So we like to say, when you donate, advocate. And in our framework, in the Simcoe County framework, advocacy is mentioned, I think we counted over 50 times. So it is a real, it's what we need to do. And income solutions are the solution, but there are a number of different income solutions at all different levels of government. And some of the big ones are, yes, basic income, increasing minimum wage, increasing social assistance rates, livable wages, and could go on and on. But those are kind of the big, impactful ones at the federal and provincial level. But there's a lot you can do locally too. So getting involved in your local food council or your working tables, poverty reduction, task groups, coalitions, those types of things. Getting together, writing a letter, signing petitions. There's a number of different things that you can do. And again, like Chris said, writing a letter to your local politician or going up to the provincial and federal level, it all has an impact. And we've seen what that can do recently with the announcement of the federal school funding. So advocacy does make a difference.
And I should walk back my language a little bit. The federal government did have a significant investment around food in schools as well, didn't it? Yes. Yeah.
Significant as it, but yes, they started the momentum of because it's $1 billion over 5 years. It's wonderful to start the conversation around it, but it equates to like $2.20 per kid. Well, so being able to that is an incredible investment, but it needs to be supported by that's another podcast we can get into. But it needs to be supported by every single province and making sure that, because that's a huge deal. But that money needs to be managed appropriately and effectively by our province. So there's a lot of work to be done there.
And I think it's also, if we think about this conversation, we can't expect also one budget announcement to be a one and done this is solved, right? Because it's been a generational problem that's led to this point of crisis. It's going to take as many years to undo what we're experiencing today as it did to get to the point where we are today.
Yeah. Right. Oh, 100%. Absolutely.
If you could leave people, listeners, with one thought or message, what would that be?
I'll go first. You want me to go first?
Sure, yes.
What's about this subject matter? So I would say just respecting and providing dignity to the people that are different than you. Mm-hmm. And if it's individuals in poverty, if it's individuals just that look different, just respecting individuals that are different.
I like that.
For me, it's just realizing that household food insecurity can impact anyone at any time. It could be one paycheck away from being food insecure. So letting all of our judgments go. Food insecurity is affecting those that work. People that are receiving social assistance, they're just not getting enough money, so it is hard. Again, people who are working, people who have mortgages, it's impacting everyone. And so I would just, let go of those judgments, and see what you can do as an individual to make a difference based on some of the things that we suggested. And knowing that if we have a food secure community, we're all healthier for that.
Awesome. Yeah. Chris, Vanessa, thank you so much for joining us today. Today on the Resilience Rising podcast, we were joined by Vanessa from the Simcoe Muskoka District Health Unit and Chris from the Sharing Place in Orillia. Both of their agency information will be on our podcast pages alongside further resources. I'd also like to thank our studio partners at Uplift Black, Center for Social Justice and Inclusion. We recorded today's podcast at their Upbeat Box creative studio in downtown Barrie. And of course, thank you to you, our listeners, for tuning in. If you like this episode, please subscribe and like us on social media to let others know about the Resilience Rising podcast. The podcast that shatters poverty myths, sparks optimism, and fuels innovative change through community-inspired discussion. You can promote us using the hashtag ResilienceRising.
We'll see you next time on episode 7, which will be dropping soon when we discuss healthy healthcare, a person-centered approach to well-being. I'm Amanda Fellows of CFS Counseling and Wellbeing with my co-host
Ryan Shelley from the United Way of Simcoe Muskoka.
And we're asking you to embrace innovative change to ensure our communities are great places to live for everyone. Thanks for tuning in.